To our special invitees, Dr. Ertadisa Hamilton, my immediate right, and next to her we have Ms. Ninian Blair, who's a consultant from PAHO, WHO. Our CMO, our Chief Medical Officer, Dr. Narayan Singh, has said that he will be a little late. He will come later to give his remarks, so he's not here at this point in time. And also Dr. Dudnot said that he unfortunately had an accident on his way here. So a canter ran into his back. So he's on the road sorting with the police, and he too will be here shortly. But we will proceed, and as they arrive, we allow them the opportunity to give their remarks. I would also like to acknowledge Nurse Tucker, who is the BFHI coordinator, Baby Friendly Hospital Initiative coordinator. Nurse Tucker, please give us a wave. And her assistant, the Baby Friendly Hospital Initiative assistant, Sister Barcoy. And most of you know her. And I would also like to acknowledge Ms. Diacola Gittings, who has been a great help on this program. She is attached to the Food Policy Division, Ministry of Health, and she's one of our community nutrition officers, Ms. Diacola. And I also would like to acknowledge the press who's here today to ensure that what we do here is broadcast, is aired, and persons are aware of the program that we're doing and the way forward as we make moves to ensure that our babies are breastfed. All right, I am Jillian Trim, and I'm the Director, Acting, and also the National Breastfeeding Coordinator, and I will bring you opening remarks according to the program. Now, Guyana, through the Ministry of Health, recognizes that breastfeeding provides the ideal nutrition for our children, and this is significant for their optimal growth and development. Now, in 1991, the World Health Organization and UNICEF launched the Baby Friendly Hospital Initiative program, and this was to help facilities that offer maternity and newborn care to implement the 10 steps to successful breastfeeding. The overall objectives of the BFHI program are as follows. 1, to enable mothers to make an informed choice about how to feed their babies. 2, to support early initiation of breastfeeding. 3, to promote exclusive breastfeeding for the first 6 months of life. 4, to ensure the cessation of free and low-cost infant formula supplied to hospitals and other health facilities. And 5, to include possible at a later stage, where needed, other mothers and infants who need care or have other issues. Now, in 2000, under the Baby Friendly Hospital Initiative program, we had 3 hospitals that were accredited as baby friendly. 1, West Demerara Regional Hospital. Is the West Demerara representative here? Give us a wave. Congrats. And Soddy Hospital in Region 2. Who's the Soddy representative? Very good. And Wisma Hospital in Region 10. Good. And you're all seated together. Then again in 2016, we had another round of BFHI initiative, 2015 and 2016, where we had 11 hospitals were accredited as baby friendly. So for 2015, we had West Demerara again, Davis Memorial Hospital, Maikoni Hospital, Linden Hospital, Madhya Hospital, and Upper Demerara Regional Hospital. Then in 2016, we added 5 more. Oscar Joseph, Public Hospital Study, Georgetown Public Hospital Corporation, New Amsterdam Regional Hospital, and Skeldon Hospital. Now, last year, the Food Policy Division, in collaboration with PAHO and UNICEF, embarked on another countrywide baby-friendly hospital initiative program. And the objectives are to have hospitals all certified as baby-friendly, either certified or recertified, those that were originally certified. Now today we begin a 5-day training program where 11 focal points representing each of the 10 regions of Guyana. And these persons were recommended by your RHOs or your CEOs, and you will be part of a strategic implementation plan in your region. So when you leave here, a lot is riding on your shoulders. So ladies and gentlemen, I bid you a warm welcome to this opening ceremony of the Focal Point Training for the BFHI program. Thank you very much. And I will now call on the Director for Primary Healthcare, Dr. Ertenisa Hamilton, who will bring brief remarks at this time. Let's welcome her as she comes.
Good morning, Ms. Trim. Thank you for the introduction. Ms. Lillian Blair, Consultant for Breastfeeding and Nutrition at PAHO WHO, Guyana Country Office. Nurse Tucker, Nurse Barcoy, our colleagues from the Food Policy Department, and all the regional staff who are present, acknowledging your presence here this morning, as well as members of the media. The Baby Friendly Hospital Initiative is part of a bigger program which looks at nutrition in the context of our country. And we look at nutrition specifically because there has been many efforts that looks at the survival of the young child as well as the increasing of the life expectancy. And one of the cross-cutting area that has a deep role in the child's survival is nutrition. It begins, of course, from us having the conversation within the first 1,000 days of life, where the baby-friendly hospital and breastfeeding has its major role. Over the years, there have been many efforts to increase the rate of exclusively breastfed babies within our country. We have made some progress, but there's still a lot more that needs to be done. And if we look at the broader picture, there's a lot to be done from the perspective of education, and the education begins within our clinics. And it should even begin even before we begin clinics, understanding very clearly that there are many entry points within the system where education can begin. The Ministry of Education has their Health and Family Life Education program. That is a good entry point for us to begin the conversation about nutrition, especially when we look at the context of child survival. The earlier you start exposing people to information, the easier it is to have the behavior change that we're looking for. And notwithstanding the fact that our antenatal clinics see at least 96% and over pregnant women on a yearly basis. So we have no room to say that there isn't a platform for us to begin the conversation about education on breastfeeding. And we have to initiate the conversation. And the conversation should not be a one-time thing. We have at least 4 to 8 encounters with most mothers at the antenatal clinics, which is 4 to 8 opportunities for us to really get that conversation in. And we ourselves have to be educated, because we recognize that a lot of times the conversation does not happen because our health workers are not confident with the message that they have to deliver. And so a lot rests on us being able to provide updated information, because parents and other members of society are reading. The internet is full of information. So it's not the day in which whatever you say works as law, but people are coming with information. And if we don't take the steps to ensure that we are informed, then it means that we will always have that problem with the confidence of what we're saying. Because in a lot of cases, when people have information and you do not have it, then you do not know how to initiate the conversation or even to carry it on. And so there's a lot that the people sitting in the room who will be educated should not depend only on what comes to you from this forum. But you have to take the opportunity to look at new information that is provided to add to what you will be taking away here. There's so much information that 5 days is just not enough to speak on breastfeeding. And there's so many strategies that have worked in different places of the world where people have worked to increase their breastfeeding numbers. We have a real opportunity within the context of our country to push this message and to get the results that we're looking for. But of course, everything that we do need champions. And champions means that there are people who will take it, who will run with it, who will be passionate about it, and work until you get the results. If we have no champions, we will have no change. And it begins with each and every one of you sitting in the room. So this morning, I would like to say, let us not just look at the breastfeeding from the perspective of the baby and the infant, but let's look at it as how it contributes to the bigger picture of your country. Our country is growing very rapidly, and so we need to ensure that the children that becomes a part of the system are children who are well fed, who are healthy, and the health begins with breastfeeding. So put that at the front of what we're doing. We will be making our contribution to our country by ensuring that mothers understand how important it is to breastfeed, because they will be ushering in the new generation who will take all of the work that we've put in over the years and push it forward. So with that, I say thank you very much to PAHO, to Ms. Trim, Nurse Tucker, and the other members of the team, and all of you sitting here. I do hope that at the end of this 5 days, you will have a renewed passion for breastfeeding, and we will go at it with new vigor to ensure that our women know the value and the importance of breastfeeding their baby. Thank you.
Thank you very much, Dr. Hamilton, and I concur with everything that you have said here today. And she used made some vital points and some vital phrases. She spoke about child survival, very important as it relates to breastfeeding. She made mention of the first 1,000 days of life, which is from conception to the child's second birthday. That's the child's window of opportunity. Whatever they're exposed to during that time lays the foundation for that child. And she spoke about passion. Passion. We need to be passionate about what we're doing. As I always would say, if you don't buy it, you wouldn't be able to sell it. Because the mothers, they will see and they know that, listen, you don't really believe in this thing. Right? So let us buy it. Let's be passionate about it, and let us sell it with the vigor and the vitality that Dr. Hamilton mentioned. So thank you again, Dr. Hamilton, for your remarks. And we now move over to Ms. Ninian Blair. Ms. Ninian Blair will be representing Ms. Janice Wolford from PAHO WHO. Ms. Janice Wolford, Dr. Janice Wolford, unfortunately could not be here today. We sent her an invitation, but she expressed her disbelief at not being able to be here today. So she has asked for Ms. Blair to speak on her behalf. So we now would like to invite Ms. Blair to the lectern to offer remarks on behalf of PAHO WHO.
Good morning, Dr. Ms. Trim, Dr. Hamilton, thank you, Nurse Tucker, our BFHI coordinator, Sister Barkoy, our assistant coordinator, Diakola, one of our BFHI trainers, and to you focal points from across the 10 administrative regions of Guyana. I bring greetings from PAHO. As Ms. Trim indicated, I will be speaking on behalf of Dr. Wolford. PAHO WHO, in collaboration with the Government of Canada, continues to support the scaling up of the National Breastfeeding Program, as breastfeeding has been recognized as the important medium for breastfeeding action, which contributes significantly to the child survival and safe motherhood initiatives as part of their maternal and child health programs. It also contributes to the attainment of their sustainable development goals. The Baby-Friendly Hospital Initiative, which has a systematic process for awarding institutions the designation of baby-friendly, entails the implementation of the 10 steps to successful breastfeeding, which summarizes a package of policies and procedures that facilitates providing maternity and newborn services and should implement to support breastfeeding. It ensures that mothers and newborns receive timely, and appropriate care before and during their stay in the facility to enable the establishment of optimal feeding of newborns, which promote their health and development. When we looked at UNICEF's data from the mixed survey on practices related to breastfeeding, it indicated skin-to-skin contact immediately after breastfeeding is at 37% in 2020. Early initiation within 1 hour of birth, another key breastfeeding baby-friendly hospital practice, declined from 49% in 2014 to 46% in 2020. And exclusive breastfeeding, which is still a national concern, with only 28.8% of breastfeeding mothers practicing the same. Health workers like yourselves who care for women and children in the antenatal period, as Dr. Hamilton indicated, the postnatal period and beyond, have a key role to play in establishing and sustaining the practices of breastfeeding. However, many health workers cannot fulfill this role effectively because they have not been trained to do so. It's not saying that they don't have any breastfeeding training, but the BFHI training has, we have to whip that up again. Additionally, little time is assigned to communication and support skills for breastfeeding and infant feeding in the pre-service curricula of doctors, nurses, midwives, and other health professionals. So this is something we have to address. PAHO, WHO, supported the Ministry of Health to fill this gap by strengthening the competency of health workers, health professionals, and managers in the implementation of the revised 10 steps, using the train of trainers approach to train a cadre of 9 trainers in the updated course built on the revised 2018 10 steps to successful breastfeeding. This is the latest version of the guidance for implementing the BFHI in facilities providing maternity services. We also use the implementation guidance, which is also going to be part of this training later on in the week. Now, PAHO continued to provide support to the cadre of trainers to replicate this training in regions 2, 3, 4, and 10 so far, targeting 74 healthcare workers in the health teams at 12 hospitals, including 2 private hospitals. PAHO, once again, is supporting the Ministry of Health in its effort to scale up and sustain the BFHI program to train new focal points from the 10 administrative regions to be supported by the first cohort of 9 trainers who will be trained also this week to start the mentorship and monitoring of this new cohort of breastfeeding trainers to improve the health and through the promotion, health of infants, through the promotion, protection, and support of breastfeeding. To your focal points, I encourage you as a team, and as Dr. Hamilton indicated, I encourage you as champions of breastfeeding to work hard with the targeted hospitals aiming for certification or recertification to achieve this goal of BFHI as you implement the plans with continued support from PAHO WHO. With this, I would like to formally declare this second round of training of trainers open. Thank you.
Thank you very much, Ms. Ninian Blair, Consultant, PAHO, WHO. This has brought us to the end of our opening ceremony this morning. I do not see any more of our special invitees arriving, so with that, I would like to say thank you very much for coming. And as Ms. Blair said, we would like to champion the cause of the BFHI program, and the 37% early initiation, we would like to have that increase, and also the 28% of exclusive breastfeeding, we would like to have those rates increase. So with you, with the other health workers, with PAHO, and with UNICEF, we're going to put our shoulders to the wheel and we're going to work to improve the breastfeeding rates in Guyana. Do I have your concurrence? Yes. Are we on board together? Yes. So thank you very much. And with that, I would like to declare this formal ceremony at an end. Thank you very much. Thank you, Dr. Hamilton. Thank you, Ms. Blair.